All right. Good afternoon, everyone. My name is Jeff Cooper, Health Commissioner at Public Health Dayton, Montgomery County. Thank you for being here today. Again, we're pleased to have guests from our community partners who are willing to share information to update citizens. So joining us short now is Nan Whaley, Mayor of Dayton, Haley Coretta, who is Public Health's Food Systems Manager, Sarah Hackenbrack from the Greater Dayton Area Hospital Association, and then Michael Doan, Public Health Medical Director. So today, Governor DeWine at his press conference talked about the urgency regarding the shortages with personal protective equipment for our state. It's a national issue, it's a global issue. But it is important to recognize the wonderful work that Battelle Labs is doing in terms of now having a process to sterilize N95 respirators, and it's important to recognize that each of those respirators can be sterilized up to 20 times, so it really extends the use of that vital life-saving equipment. And we also learned today that Apple has donated 100,000 N95 respirators to the state of Ohio, so those are certainly positive actions that they're helping us respond as a state. Unfortunately, the governor also referenced that it's Child Abuse Awareness Month and that we're seeing fewer reports of child abuse. Those actual reports have decreased. Obviously, that's a function of children being at home now. Fewer people observe those children. They're interacting less with others. So unfortunately, this stay-at-home order has an unintended negative consequence, and we all need to be aware of that. So if anyone even believes that a child is experiencing violence or abuse, you need to report that. Anyone who abuses a child is a coward. None of us stand for that. And it's up to us as a community to protect our children. We also learned about additional work the Ohio National Guard is doing in terms of helping food banks. And with one of our speakers today, Haley Coretta, it's very relevant to the information that she will present to us. And then obviously they continue to work with the hospital systems and the Ohio Department of Health regarding expanding our hospital bed capacity. So today, Dr. Acton from the Ohio Department of Health talked a little bit about the SIR model in terms of slowing the spread: susceptible, infected, and recovered. And it was a really nice graphic, and it was very easy to understand in terms of the work that we're doing collectively in terms of flattening this curve. The data statewide, as well as our community, as well as nationally, indicate that we must stay the course on our social distancing interventions. So we need to continue to flatten the curve. We're doing a great job, but we've not yet peaked, and we know that's coming by the end of this month or early May. Our collective actions, however, are working. If you look at Ohio, we are a national model in terms of responding to this pandemic. We heard today from Dr. Acton that her initial estimates based on modeling that, as we headed towards the peak, we would have 6,000 to 10,000 additional confirmed cases per day in this state. That projection has been revised to now approximately 1,600 additional cases per day. That's fantastic news for this state. And it's because of the collective actions and the work that we're all doing, including our citizens, to make sure that we protect each other. We need to be mindful, though, that there's always the potential for a second wave, and that's on everyone's mind. So we also had questions to the governor today regarding, well, when will we know that we would be heading towards recovery and there's the potential for partial lifting of these restrictions that we're under in this stay-at-home order? So obviously there are a lot of factors that go into that decision making, but it has to be based on data. So it's data-driven decision making. Clearly we would want to be able to say as a community and as a state that we have a sustained reduction in confirmed cases. Now, the designated time period for that sustained reduction, probably several weeks. So over a several-week period at minimum, we would have a daily reduction in confirmed cases. Hospitals then would be able to essentially return to normal operations and would not need to use alternate care sites in terms of bed capacity. That's really important, that they could care for their existing facilities for ill individuals within the hospital. We should have sufficient testing capacity, and we know we're not there yet, but anyone in Ohio that we deem should be tested would have the ability to do so. And then obviously local health departments should have the capacity to track confirmed cases and close contacts of all of those confirmed cases. So those are some examples of criteria that would be used in terms of recovery, designating a recovery phase, and partial lifting of some of these restrictions. And then we should never forget about prevention. So the public health message of prevention will be with us forever. I think we all understand that life as we know it will change forever as a result of this pandemic. I can't envision ever working in an environment anymore where we're not obsessed with washing our hands, covering our coughs and sneezes, keeping our hands away from our faces, cleaning surfaces routinely. And whether we like it or not, we're all going to be reluctant to initially run out and be in large crowds. And it's perhaps unfortunate, but handshakes may become a thing of the past. We'll see how that goes moving forward. But certainly the public health prevention message is going to be key in our recovery efforts. So regarding our local community, you know, the governor talked about the shortage of personal protective equipment. So N95 respirators, surgical masks, gowns, gloves, face shields, etc. And as you're aware, back in March, Sarah from the Greater Dayton Area Hospital Association informed us regarding options for individuals to donate that type of personal protective equipment. So we have donations that have come into our county from citizens, as well as caches of these items that either public safety forces had, or public health had, or that we received from the Strategic National Stockpile. And it's good for us to be able to report that over 150,000 items have been forward deployed to entities that need it, including hospitals, law enforcement, fire, EMS, and long-term care facilities such as nursing homes. No, it's not the full amount that we need, but at least we have some ability to protect those individuals. And that includes over 50,000 N95 respirators have been deployed, 25,000 surgical masks, as well as 72,000 gloves, as well as some additional material. So that's phenomenal in terms of trying to protect our citizens. And then lastly, in terms of a local update, we've talked previously about Public Health's Purple Book, the health assessment. It describes the health of our community as well as areas where we need to make some improvements. And as we're learning with this pandemic, yes, we are all susceptible to this virus, but most healthy individuals will be able to recover at home on their own, very unlikely to need any type of hospitalization. But we are also aware that those with underlying medical problems are at greatest risk for serious health problems once they're infected. So individuals with heart disease or cancer or stroke, who've had a stroke, diabetes, obesity, etc. Those individuals are at greater risk of serious health complications from COVID-19 infection. Those are also, take this pandemic aside, say it's not even happening. Those are the leading causes of premature death in our county every year, regardless of whether or not we have a pandemic. Mental health and substance abuse, we're all familiar with those issues. STDs, tobacco use. 25% of our adults continue to smoke on a daily basis. That puts them at great risk, especially during this pandemic. If you ever thought about stopping tobacco use and stopping smoking, and or if you're currently vaping, there's never been a better reason to stop. You do not want to be infected with this virus if you are a smoker or someone who vapes, because whether you like it or not, you have reduced lung function to begin with. And this puts you, potential infection puts you at much greater risk of serious health outcomes. And then also, for today's discussion topic with Haley, food insecurity and poor nutrition are key factors involving the health, or determining the health of our population. 22% of our children experience food insecurity on a daily basis. So there's a quote in this Purple Book, and it says, your longevity and your health are more determined by your zip code than your genetic material. So we all understand that it's a fundamental truth that proper nutrition is key to a healthy lifestyle and a healthy diet. Overall well-being and health, you need a healthy diet. But the reality is that not everyone has equitable access to fresh, healthy food. There are many barriers that individuals experience in terms of having the same opportunity to get healthy food. Some people don't live in an area where there's a grocery store. Many individuals live in a food desert, or they may have transportation barriers to getting healthy food. And some of our children go to bed hungry at night. That's not right. Children should not go to bed hungry at night. So all of these issues are especially relevant during this pandemic, because what happens is that those who are most vulnerable during normal times are then at much greater risk for additional issues and problems and barriers when we experience this pandemic, because they're further isolated and they simply have more barriers that are put in place that prevent them from being healthy. So the Food Equity Coalition, this collaborative that's happening throughout Montgomery County through many, many partners, is working diligently to make sure that we build an effective food system for this county. And Haley Coretta is going to give us an update on items relevant to this pandemic that the Food Equity Coalition is working on. So that's a brief local update, and with that, we would welcome Mayor Nan Whaley to the podium. I tried a different cloth mask today. I used the Surgeon General's template.
How'd it go?
I think I like the other design better. This one's a little awkward.
Thanks, Commissioner. Well, good afternoon, everyone. Appreciate what's nearing the fourth week of this effort and the difference that we're making across the community and across the state of Ohio. As we enter Holy Week, and today, for example, is one of the holiest nights for the Jewish faith, and as we enter Holy Week for Christians, we are undertaking an effort to really talk to leaders, faith community members, and we'll be having a call with them Friday morning to discuss in detail what exactly they're doing and really entailing on them how difficult this must be for them, but how we really encourage people not to have service during this time. So we are encouraging pastors from across the community not to do that. There are other ways they can have service virtually, and are encouraging that effort, particularly as we enter Passover and Easter Sunday and Holy Week. We've been getting a lot of complaints at City Hall around ice cream trucks and social distancing. Again, I think they're allowed to continue, right, Commissioner Cooper?
We have indicated that they can. Maybe I'll say this. Thank you, Mayor Whaley. So regarding ice cream trucks, we have indicated that they can operate right now. However, if we begin to receive complaints, and those are sustained complaints regarding social distancing, then we will issue cease and desist orders, and there will be no more ice cream trucks working throughout or traveling throughout communities for children. So no question, ice cream truck operators, you must adhere to the social distancing requirements, or Public Health will be issuing a cease and desist order.
Thank you. So we've started to get some of those complaints, so please, if you are working an ice cream truck, please pay attention. We're paying close attention. You need to adhere to the social distancing rules, and I know we stay in close contact as those complaints come in to City Hall as well. I also talked to the governor today, like I normally do, and we had a discussion around natural hair salons. I know for lots of folks, hair is becoming an issue, maybe for other folks not so much. First, want to really encourage salon owners that own places for product for natural hair, that you can still call folks that you serve and ask if they would like to purchase natural hair products. You can't go to their location or inside their house and perform that duty, but you can provide product by calling and delivering. This is becoming a bigger and bigger issue, particularly for women in our community, so I want to encourage hair salons to provide that service by delivery and calls, and really try to be as helpful as possible I know that once we get through this, everyone will be excited to go back to their barber or salon shop, but in the meantime, I know Square One did this a little bit last week where they did orders by phone and then delivery, but we want to encourage other salons to do that as well, as people are calling about that. I just want to let you know that DPS did their weekly delivery to food for children, as we're going to talk about food insecurity here in a minute. That they started, the first time they started this was March 16th. And today, including today, Dayton Public Schools has delivered 193,480 meals to our community. It is an enormous number since March 16th. I want to thank Dayton Public for organizing this work and doing it in a really terrific way, because if we didn't have them doing this, the number of children that would be hungry in our community would be astounding. And so I want to thank Superintendent Lawley, her entire team, and the countless volunteers that come every Wednesday to deliver and pack these, social distancing, of course. It is a yeoman's effort in our community, and I'm very grateful for the work that they're doing in our community. Last, we've talked about PPE donations to hospitals, and we're grateful for folks that have done that. We have some frontline workers, and I talked a little bit yesterday about it, grocery line workers and bus drivers and people that are turning water on at the City of Dayton. And we are doing a cloth mask collection for those folks at City Hall. We're partnering with RTA, United Food and Commercial Workers, Local 75, which are the people that are in your Kroger stores, and we'll work with them. If you bring masks that you have made that are cloth to the City Hall. City Hall is publicly closed, but there is that atrium area as you walk up the steps. There's a box there. We encourage folks that sew, that are able to provide cloth masks. This is not PPE, but cloth masks for these frontline workers. They would be really, really appreciative. These are the folks that are out every day among us, and it's a way that they can share their kindness as well. So a lot of updates today. Appreciate it. One more thing I want to mention. On this morning, we also did a call with about 6 schools, not only Dayton schools, but schools across the region. They are underway, these high school students, to start messaging to their peers about physical distancing and the benefit of it. It was an uplifting call. We're going to meet again in 2 days via Zoom, but certainly appreciate these leaders coming together to figure out ways that they can talk about why physical distancing matters for people in their age group as well, and appreciate their leadership. So more to come on that. That's what I have today, Commissioner Cooper.
Thank you, Mayor Whaley. Next, we have Haley Coretta, our Public Health Food Systems Project Manager.
All right, good afternoon. My name is Haley Coretta, and I am the Food Systems Project Manager here at Public Health Dayton and Montgomery County. I'm here today to talk about community food security in Montgomery County during this especially difficult time. Before the pandemic, 17% of our community was considered food insecure. We have over 70,000 residents on the Supplemental Nutrition Assistance Program, also known as SNAP, and too many of our neighborhoods were considered food deserts. Unfortunately, we know that these numbers continue to grow each and every day. Based on calls from United Way's 211 HelpLink and the food bank's information, we're seeing more people experiencing hunger for the very first time. If this is you or someone you know, I want to encourage you to reach out for assistance. It's okay to ask for help. We have a wonderful emergency food system here in Montgomery County, and they are here to help you. If you are in need of food assistance, I'd like to give you a few resources to consider. The food bank's drive-through food pantry is open Monday, Wednesday, and Friday this week from 10 to 12. Anyone is eligible. Hours for the following week will be released at the conclusion of this week. So if you want to know about hours for next week, please look at their website by Friday. You can find this information on the Food Bank's website at www.thefoodbankdayton.org or by calling 937-949-4096. The Food Bank's 53 partner agencies also serve food throughout Montgomery, Greene, and Preble counties. Please call 937-949-4096 4096 or 937-238-5132 to find a pantry close to you. You can also call United Way's 211 to find additional food resources in Montgomery County for your family. Ohio has also received federal approval to run a disaster household distribution program, which will waive administrative verifications normally required at food banks. So this means you can get through the drive-thru a lot quicker now. If you're homeless, I want you to know you can still call the food bank. They're working with many partners to make sure that food is getting to anyone in our community regardless of the barriers they may have right now. You can also still visit House of Bread as they are doing to-go orders. Every school district in Montgomery County is providing meals to students in need. Families are encouraged to contact your local school district for more information on how to access food for your children. The Area on Aging has received supplemental funding from the Ohio Department of Aging through the Families First Coronavirus Response Act for congregate and home-delivered meals to serve our vulnerable older adults. Approximately $400,000 is being used in Montgomery County for carry-out and home-delivered meals through the Senior Resource Connection. If you are a Supplemental Nutrition Assistance Program participant, also known as SNAP, there are several new updates I want you to know about. SNAP participants can now purchase groceries online for drive-through pickup to minimize exposure to COVID-19. Just order your groceries through the Grocers app and click EBT card and for your payment information. Secondly, a SNAP participant who did not receive the maximum monthly allotment for their household size in March will be issued an additional payment beginning this week. The Montgomery County Food Equity Coalition and its partners continue to identify needs, address gaps, and coordinate existing resources to ensure every resident has enough food for their family. If you are interested in supporting our food system during this time, I have a few things for you to consider as well. Contact the food bank if you're a nonprofit who is interested in distributing food to your community. They can help you. If you are healthy, consider safely volunteering to distribute food by signing up at www.declare.org/givehelp. You can also minimize food waste. In this uncertain time, many of us are purchasing or receiving more food than usual. Consider eating or freezing items before you need to throw them away and checking your fridge often to prioritize the foods that may spoil quickly. If you are grocery shopping, please only buy what you need for the week and stick to your shopping list as much as you can. I know that can be difficult right now. Lastly, support our local food businesses and growers. Order carry-out or purchase a community-supported agriculture box, also known as a CSA box, from a local farmer for fresh produce, dairy, eggs, and meat. Food is one of our most basic needs. It not only keeps us healthy, but is one of the best ways to connect with one another. I encourage you to continue staying healthy and safe and finding creative ways to support your neighbors and our food system. Thank you.
Thank you, Haley. Next, we have Sarah Hackenbrack from the Greater Dayton Area Hospital Association.
Thank you so much, Commissioner Cooper, and a special thank you to Mayor Whaley for bringing me my fabric mask that I was able to wear today. So this is really the perfect example of the kindness that we've been asked to show one another. And I think we are seeing the efforts of that kindness play out in the data that Director Acton was showing us today. And so we know that we are not through this situation entirely, but it is important to recognize and honor the work that you're doing and the collaborative spirit with which we are all taking these social distancing measures to heart and putting them into action in our day-to-day lives. And I think this is an appropriate opportunity to really honor that contribution that we're making to society, specifically to make sure that as we put these social distancing measures in place, as again, the reminder is that this gives us the opportunity to flatten that curve, to reduce the number of people that catch COVID-19 and then actually need hospitalization and need the care in an intensive care unit in our region's hospitals. So everything that you're doing is actually making sure that we can safely care for people right here in the Dayton region. Thank you.
So I know this may come as a disappointment to some, but Dr. Doan really didn't have any additional comments to make, but he is available for questions. So with that, we'd be happy to answer any questions.
I have a question for the food bank. I was wondering if you could give us any numbers. How many people have reached out to get help at this time? We don't have numbers, but right now the food bank is seeing over 200 families every time that they have their drive-through open.
And then you talked about the people with SNAP benefits and everything like that. What are some other ways besides the app that they can get some help?
I would encourage them to call the grocer that they prefer to shop at, because they may have other methods of how you can still use that pickup delivery option right now. It's still, no matter if you're on SNAP, you can still call the food bank. You can still get food through other ways as well.
And you did talk about them getting some extra money. Can you touch on that a little bit more?
I don't have.
Repeat the question.
Sure. The question was, is the food bank getting additional money? I don't have anything specific right now to share about that. You can always call the food bank for more information.
About the SNAP benefits, though, what extra funds were you speaking of?
Sure. So the funds for SNAP families, if you for some reason didn't receive your maximum allotment in March, there are families that maybe don't meet that maximum amount. They are coming back to make sure you get that payment in April. So it should stretch you a little bit farther than maybe typical times.
I know food deserts are a big issue for a lot of families here. What advice would you give to them at this time?
If anyone lives in a food desert, the advice I would give them is to still, you can call the food bank. They're working with partners, not just through their drive-through, but throughout the region to make sure people have food regardless of their barrier. So if it's transportation, there are mechanisms to still make sure you can get food if transportation's a barrier for you.
Someone on the phone, Dan? Yes. No one else has any questions? Does anybody on the phone have a question for us?
Drew with WHIO TV. Just had a question for Sarah from Gadaha. With this new curve that has come out today, the OSU curve that the state used during the governor's press conference, shows a steep decline, as you guys talked about. Good news. We're looking at from 10,000 cases per day at the peak, now down to looking at a projection of 1,600 cases per day at the peak. Is there concern among Gadaha with the financial viability of our area hospital systems, and will they be able to recover economically if they're not seeing the amount of cases initially projected, and could this hurt the ability for them to bring back people to work that may have been furloughed at our hospital systems?
Okay. Great question, Drew. So Drew was asking about the financial and the economic impact now that we may not see as many cases of COVID-19 here in our region. And really, Drew, when we think about that particular challenge, our hospitals are already financially constrained and impacted by what is happening right now, because earlier in March, we actually suspended non-essential or elective surgeries. And so because of that, we have already seen a very steep decline in the number of surgeries, as well as inpatient procedures and outpatient procedures, in order to conserve PPE in our region. And so the financial viability is something that our members are actively concerned about. And as that surge does really still come in our region, it may not be as high as we were initially predicting or expecting, but it is going to be more manageable for us, and that will allow us to bring those temporarily furloughed workers back into our workforce to actively care for the patients that we have here in our community. Thanks, Drew.